Hello everyone, it's Dr. Nicole Anderson here, and thanks for taking the time to listen to our Erase Neck and Back Pain workshop. The more trips around the sun that I take, the more I realize that time is that one precious, unrenewable resource, and I highly value my time. I'm sure you do as well. So we are going to make sure that you really get some good value out of this time. So I wanted to share with you a little bit about nutrition first off. It's foundational. It's one of our 4 pillars of health, which we're going to talk about in this workshop later. So very good nutrition is going to, number 1, give you the right fuel that you need for healing to take place. And number 2, if your nutrition is more on the side of promoting inflammation in your body, then it's not going to allow you to heal properly. And if you have more systemic inflammation going on in your body, then your body is going to be more prone to higher levels of pain if you are injured or if you are trying to recover from an injury. So we all want less pain, right? So one of the easiest things that you can do to help decrease pain is actually to make sure that your nutrition is on point for actually being more on the anti-inflammatory side of things. So 2 of the most inflammatory things that you could possibly consume are sugar and grains. A lot of people tell me, all right, well, I'm not going to give up my cookies, I'm not going to give up my ice cream, and I'm not going to give up my crackers and my chips and my tacos and burritos. Well, the good news is so many people are trying to minimize sugar in their diet and they're trying to get rid of grains that it's actually pretty easy to eat a diet that has all of those things with very little sugar and 0 grains. So that's how I eat. I know that's how Dr. Winters eats, and you can do this too and still not miss out on those things that you really enjoy. So I have a few examples here. Exhibit A, these Banana Joe banana chips. And I actually went to Whole Foods to buy all this stuff, and everybody who came to the workshop today got to taste these. That's one of the benefits of coming to our workshop is I make sure that we give you healthy snacks and treats to try. So these are really good source of carbohydrates, healthy carbohydrates, and low sugar, and they taste good. Another Exhibit B, all right? So next we've got Siete brand, and these are Mexican shortbread cookies, very low sugar and very tasty, no grains. And I don't know about you, but I love chocolate. So the Siete brand also makes some chocolate ones. And then my next favorite brand for no grain is Simple Mills. And they make some chocolate chip, dark chocolate, or double chocolate chip cookies. And then they make these snickerdoodles that are super good. Parm crisps are a great way to get some good protein in your diet. And the thing about cheese is more on the inflammatory side of things because it's a lot of work for your body to break it down. So that means that your digestive system is having to work hard and your body can't put as much energy into healing itself. It's better to have cheese that's been aged for 12 months or more, something like Parmesan, for example, because then your body is going to actually not have to work as hard to digest it. And this is an easy way to get it in a snack form. They're very tasty. And if you happen to like little cheddar crackers or any other kind, they have these rosemary crackers that are super good. So this is, again, by Simple Mills, and these are delicious crackers. You will not miss your whatever other kind of crackers you like to eat because these are so good, and they have several different flavors. They have plain too. So you don't have to miss out is my point. Another thing, I actually like beef jerky. Maybe some of you guys don't. I like those Slim Jims and those beef sticks and stuff, but they're not really that good for you, especially because they're sugar, and then soy can be more inflammatory. So there's this thing called biltong. And it is so tasty. It's beef, and it is 0 sugar and all healthy ingredients, no soy, just beef and spices, and it's cured with vinegar and salt and spices, and it's delicious. And so I recommend that. You can go to Sprouts and get it. And there's one that's got like, if you mess with the bag, it's got like a softness to it. That's my favorite one. In Sprouts, they usually put it off to the right. I don't remember the brand name. And then Sprouts, they also have this beef that's crispy. It's like a crispy cracker kind of thing. Very crispy though. And it's beef and it's biltong. So healthy snack, very reasonably priced. So those are some good examples of healthy nutritional options. And then if you would like more options, we can send you our anti-inflammatory food choices handout, and it will give you some more examples of what not to eat and what to eat if you want to decrease pain in your body and also increase your body's potential to heal itself. Okay, so there's some common assumptions when it comes to pain in your neck and back. Most of the time people assume that it's being caused by muscles, discs, or pinched nerves. And what we're going to talk about today is that pain in the neck and back could have a myriad of causes, a actually dizzying array of causes, and we're going to help you to learn a little bit more about what those causes are and then get a little insight into what some next steps might be to identify the root of the cause of the pain for you and what to do about it. My story is a great example of many of the things that we're going to talk about today. And I think when it's told from the perspective of someone who's lived it and experienced it, it can be so much easier to remember and more powerful. So there's a lot of factors that can cause neck and back pain that are often overlooked or not addressed. And in my own personal journey, I experienced many of those things happen. So I'm going to go back to you guys being able to see me as I talk. All right, so what I experienced was I was 24 years old and I was working at a university. I was working in their sports medicine department as a sports therapist, and I was lifting something heavy with another person off of a cart. So I was grabbing this thing and we were lifting it off and it slipped. So I twisted with it to steady it. And when I did, I felt a sharp searing pain in my lower back and it shot down my leg into my foot. And at the time I had a good guess as to what that probably meant. It probably meant that I had a disc bulge or a tear in my disc. There's a good chance that kind of symptom, that's what that would be. That would be kind of a worst case scenario. And I hoped it wasn't that. I tried to ignore it. I just kind of powered through, but the pain was pretty bad all day. And by the next day when I woke up in the morning, I could barely move. I remember just getting up and like crawling at first because I had so much pain in my back, my leg. And then I eventually just kind of loosened up and I got moving, but it was so painful. And I had to limp actually. And I had played soccer in college. I had a very high pain tolerance. I had actually played with a broken ankle. And so it was very, very concerning to me that I had this level of pain. And I saw a doctor that day. And I was diagnosed with an annular tear, meaning a herniation or tears in my disc. And so that kind of injury normally resolves, it heals within 3 months. And I actually had to take an entire month off of work. And that's a very common experience. Actually, 80% of people will experience having to take at least one day off of work or not be able to do something that they love to do because of back pain or neck pain. That was me. It was for an entire month. And when that month was up, I was able to get back to work, but I still had pain in my leg and down into my back. I was getting therapy for it. And at the end of the 3 months, it really wasn't 100% better. I was still had so much pain that I had to lay down on my lunch break just to get through the day. And about a year later, it was quite a bit better, but not 100%. I didn't know what else there was. I had what I thought at the time was the best physical therapy. that I could get. I had tried some chiropractic, and it was good enough. The back pain went away. I just had a little bit of leg pain. So it was good enough that I thought, you know what, this is as good as it gets. So, hopefully it'll keep getting better over time. And I just went back to my normal life. So I'm 25 years old, and I just go back to normal life. About a year later, I'm doing a heavy leg press in the gym, which I would not recommend anybody do for the health of their back. But at the time, I still thought I was invincible. And leg press, there's just so many other exercises that are better for strengthening your legs than that. And so I just don't recommend it. Anyways, I was doing that, and I suddenly felt a terrible pain in my back again, pain down both legs, numbness and tingling in my legs. And I, ended up having to gradually keep cutting back my hours at work because the pain kept getting worse and it wasn't getting better. And eventually I got to the point where I couldn't work at all. So there I was, 28 years old now, unable to work, in 8 out of 10 pain all the time. The only way I could sleep is by taking some heavy pain medications that would be prescribed, or they were prescribed by the doctor, and they're the kind that you could get addicted to, and I didn't want to get addicted, so I only took them at night just to help me sleep because the pain was so bad I couldn't sleep. And I literally laid down most of the time because it was crushing to stand. I would have this crushing pain in my back, numbness couldn't barely feel the bottoms of my feet, tingling, numbness in my legs, and so I knew that I needed to at least stay somewhat active. So I would get in the pool and I would just move around in the pool just about every day. But the rest of the time I was laying down because the pain was so terrible. 5-10 minutes, that's about all I could manage. If I was going to a doctor appointment or something, I would lay down in the back of the car and have someone drive me. That's how bad it was. And it was like that for a year. And I went to 13 different doctors. I tried physical therapy, chiropractic, massage, and nothing gave me lasting benefit. I got to that desperate place that kind of desperate place where you will do anything. You'll try anything because you're so desperate. And I hated needles, but I went ahead and tried acupuncture. I did it 3 times a week for 6 weeks, just like they recommended. And it helped me get over my phobia of needles. And I actually noticed that I felt better while the acupuncture was in place. But then as soon as I got up off the table and started moving around, the pain was back. I knew there had to be some kind of mechanical component going on, because if my husband grabbed me under my arms and picked me up so my legs were hanging, I felt better, and actually got an inversion table to help me because I noticed that it was helping somewhat. And I had some relief when I was on that, and so I was getting on that every day. And I would go to the doctor's office, I'd show them this, and they would look at my MRI, they would look at my radiograph, which is also called an X-ray, and they would say, okay, we see that you have little instability at L4-5 because there were ligament tears from that injury that had happened when I was 24 years old. We see that you have some disc bulges. I had a couple disc bulges. I had one at T12-L1. I had another one at T11-12, and then I had one at L4-5. But they're like, you know what, you're 28 years old. And I had a doctor say this to me. I had a doctor say, you're probably going to need surgery down the road, but we want to wait for as long as possible before we do it. So, once you have surgery, it will change you forever, and you're too young. We don't want to do that. So I'm lucky I was so young to have this happen, because if I was maybe in my 60s or 70s, they might have said, hey, let's, go in there. We'll decompress your back with surgery, da-da-da. And the bad news for people that get surgery is that statistically, over 50% of people who have back surgery feel better in the first year. And they're singing the praises of their surgeon. They're feeling great. They're so happy that they did it. But then 5 years later, they're worse than they were before. Let that sink in just a little bit. Those are the stats. The stats are that for every surgery, on average, people need 2 or 3 more for their back. That isn't really what's told to patients when they're in the doctor's office and the doctor's looking at that x-ray or that MRI and saying, oh, look, here's the cause of your problem. I'll just go in there and snip that out, or I'll go in there and decompress this or that, and you'll be good to go, feeling great in about a year. Well, that's true. They will be feeling great in a year probably, but 5 years later, they'll be worse. Statistically, that's the majority. So what we're all about here is about avoiding people becoming a statistic like that. And we're able to help people who actually have been told by a doctor that they need surgery for their back or their neck. We're able to help them to avoid it, not need it, and get back to golf or tennis or whatever it is that they really want to do. In many cases, able to get back to that. Sometimes they need to make a change to their lifestyle, and golf is a lot of twisting. And for some people, if they want to have a happy, healthy back, they're going to need to quit the golf. But most people, we're able to help them get back to these activities, all of them that they want to be able to do. So in my case, I was lucky that I was so young, because the doctor said, look, you're so young, surgery is going to change you forever. We don't want to do it. Do everything you possibly can other than this. And I actually remember a doctor saying to me, these are the worst words I ever heard a doctor say. I'm 28 years old, trying to figure out, I've tried everything I know to try. I'm in this severe pain. And I just remember the doctor looking at me and just saying, can you live with the pain? And those were just the worst words to hear, because at the time, like I said, I was taking heavy duty medications for the pain to help me sleep at night. And my life, I didn't have much of a life. I was really kind of stuck at home. It was between home and the pool and laying in the back of the car to go anywhere. And anywhere I went, I had to lay down most of the time. It wasn't much of a life. And so I didn't want to just lay down and let that be the case for my life. I never quit trying to figure out what is going on. Why am I not healing as expected? Why is this pain still here that's limiting me? And I knew that there had to be something mechanical, because I got some relief when I was in the water, which meant less gravity, right? And then I got some relief when somebody was holding me, and I felt, my spine got some decompression. And I had some relief when I did acupuncture, just temporarily. So, I thought there has to be a reason, there has to be a solution. I think I had 7 epidural injections during that year, put into different places, different segments, levels of my spine. I had some arthritis at L4-5 on my spine already, that had just developed in those few years of that instability from that injury. And so they had put it on there to try to calm that, thinking that joint was maybe the issue. And that's a lot of epidural injections to have in a year's time. But I was desperate. So I just got temporary relief from the epidurals, or no relief at all. And so one day I'm asking a physical therapist friend of mine, what am I missing? What is there any other thing that I could possibly do? And I remember him just saying, well, there's this lady, she's got magic hands. Her name's Karen Kerwitz, and maybe you should go see her. So I was at that desperate place, that place where you'll try anything. And I went to her place and she had a treatment with her. She was a myofascial release specialist, primarily using the John Barnes method, but she also used some other myofascial methods. And I remember when she was working on me the first time, I just remember thinking, it feels like she's not doing anything, because the pressure was so light. I came from an athletic background. I was used to getting my bones cracked, getting those bones moved around in a chiropractic adjustment if something was off, or really heavy pressure massage, because I could tolerate a lot of pressure, and I liked those heavy massages. And I had noticed good benefits from them in the past. And so when she's doing this light pressure stuff, and just light movements of my joints in different ways, it didn't seem like this could help at all, but I was in that desperate place, so I went for it. Well, by the end of the session, I felt a little better, and I was like, okay, well, this is probably good. At the end of other treatments, I felt a little better before, but I'll come back. So I came back a couple more times, and I remember after the 3rd visit that I was able to be upright for 5 hours for the first time, when I hadn't been able to do that for a year. I still had pain, but it was tolerable. And so that was a huge deal to me. That told me that I was on the right track with what she was doing with me. And so then I ended up continuing working with her, got to a point where she told me, all right, I think it's time for you to integrate some exercise into the equation. And I had a lot of training in proper exercise techniques, but I had more than I needed to learn at that stage in my life. I was about 29 years old at that time, and still had quite a bit to learn. She recommended me to this physical therapist who specialized in getting muscle activation patterns to work properly when muscles have been shut down. And Dr. Winters is going to get into it a little bit later in the talk, but when there has been a lot of pain from an injury, or when there's been a lot of pain that lasts for a while, or if pain has just persisted for a while. So a while, I mean like 3 months, or if it was kind of a real traumatic injury where there was a lot of associated fear or concern or real danger that happened. Either of those two things, it could be either a really serious injury where there was a serious potential of loss of life or limb, very traumatic type of injury can cause this type of response in the body, or it could be just having persistent pain that lasts in one area for more than 3 months. If either of those things happens, then what can happen is the muscles and the fascia in that area become not as awake. They get sleepy, and they don't come back online on their own. They need to be retrained. They need to be reawakened, and specific exercises are needed, and then specific coaching to help you get those muscles and fascia to come back online is needed. And so we'll talk a little bit more about what fascia is later in the talk. Dr. Winters is going to cover that, but suffice it to say, I needed that coaching, and so I went to this physical therapist who has since moved to Washington State. And so she and Karen worked together to help me put Humpty Dumpty back together again and get me back to feeling good. So I would say that I got about 80% better between the two of them. And then I took some extra continuing different courses to learn more. And then I also just invented some things as well in my process, just troubleshooting, trying to figure out what would help me to heal. And through that combination of things, was able to get to the point where I was completely pain-free and totally back to everything, including surfing, which is a really intense activity. And I don't just, longboard it. I was getting out on the shortboard and going for it. And so I was able to get back to being able to do just about anything that I want to do. And that's what we're able to help people do here, largely because of all the experience that I had in my journey, and also the things that Dr. Winters knows how to do. So Karen Kerwitz is a mentor of mine, and I wish that she still lived around here. She moved to Hawaii, but she's great. And I'm so glad that she was here when she was, that she was able to help me to start to move the needle and start moving in the right direction. Another thing Karen introduced me to was the MELT method, which is a very powerful technique using a soft roller and soft balls that is a total game changer for anyone who wants to have good health. So if I didn't have the MELT method in my life right now, I would need to go see a myofascial release specialist like myself, probably on a weekly basis, because of how active I am in my professional work, but also in just the way I like to play physically. And MELT allows me to only really need to go see a specialist myofascial person if I get an injury surfing, which sometimes happens, or any injury doing something else, or just kind of a couple times a year, just a good way to just keep myself maintained. But otherwise, I'm able to keep myself really healthy. Number one, because I can do some myofascial work on myself because I know the techniques, but then also the MELT method and using vibration technology, which is a total game changer for people. And it's something we recommend to everyone unless you have had hardware put in, like you've had surgery on your spine or your hip or your knee, and they put some hardware in. In that case, then you should talk with us about what would be appropriate for you. But otherwise, vibration is a wonderful tool for releasing stuck connective tissue and muscle, for stimulating hyaluronic acid release, which hyaluronic acid is the slidey glidey stuff that helps your tissues slide and glide along each other and helps your joints be more slidey glidey. Introducing that 2-3 times a week at least, and especially after your workouts, is going to be huge for longevity and for really enjoying that longevity with a happy body. So I like to use the analogy as far as maintenance and taking care of your body properly of brushing teeth. All right. So yeah, I learned in my journey of my back recovery a lot of really helpful tools for maintaining better health long term, not only healing, but then how to maintain good health of my neck and my back. By the way, I also had a disc bulge in my neck from a accident where I fell and hit the back of my head on concrete. I had a severe concussion from it, needed to have specialized physical therapy to recover from that. And when I had bulged the disc in my neck, I had pain that shot down my arm into my hand. And I had some weakness and issues with my arm from that for a little while until that was healed. And now I have no problems with my neck or my hand or my arm. So it can be, those kinds of injuries, you can recover from them and you can get full function back. That's the good news. So anyway, I learned through these injuries and through the process of healing from them how to care for my body to maintain those good effects. So something that happens sometimes is people have a success as far as getting out of pain, getting back to function, doing all the things that they want to do again. And then a few months later or a year later, the pain comes back in the same area and they think to themselves, physical therapy didn't work, or that treatment process didn't work. Well, it did work, but what didn't work was probably the maintenance that needed to happen to keep it feeling good. And people sometimes don't really think that that's necessary, but think about it this way. Think about if you just never brushed your teeth or flossed your teeth. Just think what the state of your mouth would be, right? We maintain the health of our mouth by brushing and flossing. And that's because we've learned the importance of doing that. And a couple hundred years ago, people didn't really know about that as much. And part of the aging process was you just lost your teeth, right? Well, that equivalent is what's happening with people's bodies, with their ankles and their knees and their hips and their back and their neck and their shoulders. People think that they are just experiencing the aging process, and this is all just part of a normal part of aging, is getting achy shoulders and knees and hips and backs and necks, when in reality it's because they don't know how to care properly for their body. And if they can learn how to properly care for their body, they could be feeling so much better and not only live longer, but also enjoy the life that they're living so much more. That's what we're all about here. That's what we want to help you to do. And so that's what we teach. In our group exercise classes, these are all designed by a physical therapist, and we teach you how to release your own soft tissue using a soft roller and soft balls. And it's not using a hard tool like a hard foam roller or a lacrosse ball, because those things actually are inferior to a soft tool. The soft tools work better and they feel better anyway. So let's just enjoy feeling better and while you're doing it and feel better after, right? So those are our melt classes, our ease, pain, stiffness classes. And then we have these fitness classes where we teach you the right exercises to do to stabilize your neck, to stabilize your back, to stabilize your shoulders, your hips, and your knees, and your ankles, to improve your balance. Because a lot of people think they're doing the right exercises, and in some cases they are. Some cases they're doing the right exercises, they're just doing them the wrong way. And in some cases they really need to be doing some different exercises. The ones they're doing, maybe they're okay, but they're not doing what they think they're doing for them. Or maybe they just need to include certain ones that aren't being included. And another thing to keep in mind is that after the age of 50, this thing called sarcopenia starts to take into effect. And what that is your muscles literally wasting, and it's just part of the aging process. So when that happens, it happens because you're not using a muscle. So if you don't use it, you lose it literally after 50. Before 50, it's still there, it's just weak and small, all right? But after 50, we lose it. So that's why people start to really lose the ability to like get up and down off the floor, or they start having a lot of trouble with stairs, things like that, because they're not actually doing enough strength training. And even if they are doing strength training, they might not be doing the right kind of strength training. They might not be doing the training of the stabilizing muscles, which Dr. Winters is going to get into a little bit. So it's really important to understand that and to know what to do. So one more factor that was in play in my case and a part of my own recovery that needed to be addressed was how pain actually works. So we want to talk about that here today because it's really important to understand pain is 100% of the time in your brain. So if you have a stimulus, it's going to be picked up by sensors in your body tissues. That message is going to be transmitted to the brain. The brain's going to decide what to do with the information. It's either going to give you an output of danger, fight or flight, and you're going to feel pain, or all is well, rest, digest, no pain. So this is a super simplified, very, very simplified version of a very complicated topic. And we'll do a whole nother talk on pain and how it works, because it's really important to understand when you have had pain that has lasted more than 3 months. And possibly it might be important for you if you have had pain from a traumatic injury, where you were afraid you might die, where someone you care about was in the situation, you were afraid for their health and safety, or if you were really, really concerned that you were going to be severely damaged by this injury. So if those things happen, then what can happen is it can kick off some changes in your nervous system that you don't have any conscious control over, that will cause you to be getting more frequent messages of pain. And your pain, when you do feel pain, it's going to be more heightened than it would have been if you, number one, hadn't had pain for more than 3 months, or number two, hadn't had an experience where the pain was perceived as being potentially dangerous to life and limb. All right, so really important to understand that those two factors can put you at risk of developing chronic pain syndrome, and almost always it does develop chronic pain syndrome, and it requires a certain type of treatment to address that chronic pain syndrome. So like I said, that's a whole nother talk for another time, and we will do that talk because it's really important to do, and it, like I said, it does require a specific type of treatment as well. So let's transition over to Dr. Winters. She's going to talk about mechanical causes.
All right, so Dr. Anderson touched on a few of the lesser known contributors to back pain, such as our gut, imbalances in our autonomic nervous system, so that fight or flight mode versus our rest and digest mode, which can absolutely fuel pain, right? Can be a contributor to pain, and are areas that not everyone addresses or quite knows how. So now I want to touch on some more familiar causes of pain, and these would be structural causes. So when we say structural causes, we are referring to the bones, the soft tissue, the nerves, the discs, right? We've all heard of someone saying they herniated a disc or slipped a disc. We've heard of sciatica. We've heard of maybe someone falling and fracturing a vertebrae. That is a structural cause. The issue is in the tissue. Now, those definitely happen, but they're honestly less common drivers of pain for recurrent back pain, for chronic back pain, and we're going to go over some of the reasons why and how we've found that out. So in the last 10 to 20 years, they've done some excellent research, and the research was taking a huge sample size of people from all walks of life, ages, health, and all they did for these people was take images of their spine, right? So their neck or their back. They took x-rays or MRIs, and Let's go back to that one. So when they took these x-rays and MRIs, sorry, I was just making sure the microphone was working. They looked at the images, right? And so on these images, they found all kinds of things, right, that we don't want to necessarily see on imaging if it was your MRI or x-ray. They see arthritis, you see these narrowing of the discs, you see compression, you see things that don't look that great, right? Degenerative joint disease, right? It's images where you're like, wow, how is that person walking around? That looks terrible. And of those people with these structural findings, 50%, half of these people have no pain at all. They are skiing, snowboarding, living their best lives, no problem. Now, why is that? Is it because imaging doesn't matter and everything's a lie? No. Imaging is absolutely crucial and very helpful in certain situations. We need to look inside, right? But what it does tell us is that structural cause, that bulging disc, doesn't totally tell the whole story. So what I want to dive into now is how myofascial and muscle imbalances can create compression and pain, especially pain that lasts or continues to come back. So fascia, we went over it a little bit in the beginning of the lecture, but fascia is connective tissue. It is a spider web-like matrix. It's three-dimensional and it covers everything in our body. So our nerves, our muscles, our bones, our blood vessels. It's extremely strong, but it also is elastic, so it moves. It slides and it glides and it can get thickened. It can be really mobile or it can be really immobile. And that all just depends on how we live our lives, the activities we engage in, how healthy we are, how much we're sleeping, lots of different things that can influence it. So here, I like this visual. This is one of our fascial lines. This is our back line of fascia. You can see the blue is the fascia, how the fascia on the bottom of our feet connects all the way up to the back of our head. So if you guys are some seasoned Anderson Sport and Wellness goers, or you've worked with Nicole and I before, maybe even just in the classes, we always will talk about how foot melt can relieve pain and tension in your neck. And this is why, that fascial connection, it is continuous. So you might be thinking, okay, well, if it's not necessarily that disc in my back that's causing pain, or I do have disc bulges and I do have pain in my back and my leg, why isn't it going away? Because there are other factors going on. So I just want to talk about some things that can mimic structural pain. So here we have pictured our gluteus medius muscle. This is a muscle on the side of our hip. It is one of our butt muscles. It is a huge stabilizer for the pelvis and the spine. And here we're showing some trigger points in that gluteus medius muscle. So those are the X's that you'll see. A trigger point is an area of increased electrical activity in a muscle. It's really tender when you touch it. And it refers pain somewhere else when the trigger point is occurring. So there's certain spots where trigger points pop up in muscles, and there's certain referral patterns for each muscle. So if we look at these referral patterns for gluteus medius, what does that look like to you? Pain down the back of the leg. If you Googled it, if you went to probably a lot of different practitioners, they might say, yeah, that's sciatica. We better treat your back. We better strengthen your core. And maybe you do all those things and it doesn't help because you only touched your back. And where is the driver of this pain here? It's in the side of your hip. Another common offender is our psoas muscle. So the psoas is a muscle that attaches on the front of your hip bone through the body onto some vertebrae in your back and through fascia onto your ribs. Now look at the trigger point referral patterns that's seen in red here for your psoas. The front of your hip or in your back, right? So if I had pain right there in the front of my hip, I might go to the doctor, they might say, oh, you have a labral tear. Or I looked on Google, I have a labral tear, right? Or I have groin pain, I must have strained my groin. Or I have pain in my back, so I go get a massage to my back. And it might feel good at first, but then the pain is back. So these types of problems can mimic normal structural pain, but you're not getting the results that would be expected from addressing that structural pain. So let's go back to why trigger points occur. So trigger points occur in muscles that are either overused or injured, and those two can go hand in hand. When a muscle is weak, it does not take much for that muscle to be overused, right? You work it a little bit and it's like, whoa, this is way too much for me. And it starts to create pain and dysfunction and tightness and some of these referral patterns. Now, why are certain muscles so bossy and overworking versus others? Because of these muscle imbalances, right? Or myofascial twists and thickens based on how we move and things we do every day, which I'm by no means saying that any type of movement is wrong and you shouldn't be doing it, but sometimes we need expert level care to address those imbalances, those trigger points, those real causes of pain, and really get down to the root of the issue. So I'm sure you guys all know, but some people don't. So I'm going to go over what our core muscles are. So you probably have been told, or research on your own, or your friend who has back pain or neck pain was told, you got to strengthen your core. And then you go to the gym and you do 100 sit-ups every day for 2 months and your back pain is worse or the same. So why is that? You're strengthening your core. We all hear about how we need a strong core for our spine to be healthy. And it's likely because we're doing the non-optimal strengthening for our core, right? So we have a lot of core muscles. Most of the things that we do in the gym are not actually working these deep core muscles. So our deep core is made up of our transverse abdominis. These are like girdle-like muscles that are in the front of our body. Our diaphragm, which sits right under our ribs, so that's kind of the top of the cylinder that is our trunk. Our pelvic floor muscles, so those line the bottom. And then the multifidi are these tiny little muscles pictured here that line our spine. We can also include psoas and glutes because those are really big stabilizers. Now, any little imbalances in these muscles, certain ones not doing their jobs, are going to cause the other ones to overwork, and that can fuel pain, inflammation, and dysfunction. Multifidi especially is a fascinating group of muscles. When you go have an episode of back pain, right, or neck pain, these muscles are going to actually turn off. They've done research on this, and they do not come back online when your back pain goes away unless you properly stimulate them and activate them. They are rotators, so it is anti-rotation exercises or rotational exercises that are going to stimulate these, but in a very specific manner. So sometimes muscles just aren't even working and we don't know how to turn them on. So that's a problem, right? Something that we need to address. So I'm going to go over a breathing exercise, really easy. We want to get everyone standing up to do this exercise. Nicole and I prescribe this to our patients really early on in their rehab process for back and neck pain. So what we're going to do is we're going to take an inhale through our nose for 4 seconds. We hold that inhale for 4 seconds, and then you're going to exhale out, making a shh sound as you exhale. Now, the shh is very important because it is like adding weight for your core. So if I did bicep curls with no weight and just bent my elbow, do you think I'm going to get stronger? No, we need to overload the system a little bit. And so that's what the sound to breathing helps with in these early stages of turning on our core. So go ahead and take an inhale. Hold for 4. And then exhale for 4. As you do that, you can have your hands on your stomach and you'll feel how the abdominals draw in, those deep core muscles turn on. You can do this type of breathing. You don't necessarily have to do the 4-second hold when you're exercising. Don't want to pass out. But you can exhale forcefully, draw in those abdominals when you're working out, and that's going to help turn on those deep core muscles. So it's very valuable. But if you're just starting out, if you have a lot of pain, you're not necessarily working out in the gym just yet or doing what you love, you just can do this breathing exercise 4 times and then throughout your day whenever you want, but optimally 3 times a day. And what else it's going to help with is transition you to that parasympathetic state that we know helps calm pain. All right, I like to touch on the outer core as well. These muscles are important, but not as important as our deep core. We have our rectus abdominis, our six-pack abs pictured here. We have our serratus anterior, which is a huge stabilizer for the neck, actually. So a lot of times when we're dealing with neck pain, we want to strengthen some deep muscles that are on the front of our cervical vertebrae. Again, nobody's doing that in the gym probably, or in any other types of workouts. And then, a lot of our shoulder girdle muscles are going to help offload the system and help some of those muscle imbalances. And then I like this visual as well because you can see how deep transverse abdominis actually is. So here's another fascial line, and this is our X chain, where it shows how one shoulder connects with the opposite glute. So if you're not doing core strengthening that works one shoulder and the opposite hip, you are missing out on a lot of back support by stimulating that fascial line and strengthening it. So that is a lot of the exercises that we'll prescribe in clinic do that, right? We're integrating a lot of different things to really get those muscles back online, especially those multifidi who are on vacation. So I would like to give some tidbits of you, since we kind of told you, okay, certain exercises aren't great, we want to give you something to go home with that you can try, or just better options, right? No movement is necessarily wrong. I'm happy that people are moving and exercising. That's excellent. But there are more optimal ways to work out. Like, wouldn't you rather do 5 to 10 minutes of really challenging full body exercises than have to spend 2 hours in the gym? Maybe you love the gym. That's totally fine too. But we can be more efficient with what we want to do. And a lot of our patients want the most efficient, expert way. What's going to get me better? And so we address a lot of those in our group classes and then also in therapy. But here are some just swaps for when you're in the gym. You could tell a friend that maybe is doing some core strengthening right now for their rack. So rather than sit-ups, crunches are a better option. So sit-ups, see how much compression is already pulling down on her spine as she lifts. And that type of lift is activating iliopsoas, which again tends to be one of our more overactive muscles, because it's bigger and can provide a lot of support, but can also be feeling the pain. So now we're just working that muscle even more with sit-ups because it's such a long lever arm and it's just pulling on that spine. So instead you can do crunches. And the way we teach crunches in the clinic is by activating transverse abdominis, engaging your deep neck flexor. So now we're stabilizing our neck and strengthening in a proper way. So, and it's much less load on the spine. And then you'll see weighted side bends all the time at the gym, which, you're literally just bending to the side with a weight. So first of all, you're compressing that side of the spine a lot. And when do we ever move like that? Not to say that every exercise should be how we move, but we're never purely just reaching down to the side and picking up something heavy. No, we're rotating, we're moving, we're challenging our body three-dimensionally. So planks are a way better option because look, he's weight bearing through his shoulder. That's already strengthening all those muscles that are going to help support his neck. He's lifting out of the floor. And so now he's engaging that glute med on the side of his hip. He's activating his transverse abdominis, I'm sure, even though we can't see, but hopefully he's drawing in. And then you can add movements to this. You can be rotating down. You can lift up and down, right? So now you're stimulating all those core muscles with the instability, right? Whereas the guy in standing with the weight in the side bends, he doesn't have any instability that's turning on all his core muscles. He's just strengthening some of those muscles that are already overworked and have a pain component to them. So now we're stimulating that pain pathway again, as we mentioned earlier in the lecture. All right, and then Russian twists. We want to strengthen the spine in rotational manners, but when you're sitting up like that, again, your psoas is doing a lot of work to pull down on all the vertebrae in the low back. And so now you're getting a lot of compression. If you do physio ball Russian twists, they're super challenging. You're on an unstable surface, so even more core activation. Glute max is working to hold you up in that straight line, and look how open your trunk is, right? So psoas isn't doing any work, but now you're strengthening obliques and all those great rotators.
Okay, so I'm back. It's Dr. Anderson. So now that we've talked about many of the potential contributors to pain in the neck and the back, I want to circle back just a little bit and talk briefly, super briefly, about your gut. So you actually have you can see on this slide, it's a really complex picture, but you have the same nerves that innervate, some of the same nerves, not all, but some of the same nerves that innervate your gut, innervate your back. And that's important because if you have any kind of digestive upset going on, it can be contributing to back pain. And I've seen this with patients where they're not making the kind of progress we would expect with addressing all of the components that we address. And we're aware of their diet because we always have you guys fill out a nutrition profile when you start with us. And we talk to them a little bit more about that and say, all right, let's make some changes there, and then the pain goes away. Or we send them to a specialist because maybe they need that specialist care in this situation. So just so you know, that's something to be aware of. And it can be a very real cause of pain. I want to show you this slide about the autonomic nervous system. Your autonomic nervous system is not under conscious control. We've already talked a little bit about different components of it. We have our sympathetic, our parasympathetic, and our enteric. And in society today, if you look at the little blue guy here, the sympathetic is often dominant. Things that we participate in, like looking at screens, will bump up your sympathetic nervous system activity. And just anything that is stressful will bump up sympathetic nervous system activity. So it's something that's very important that we have a balance in our life where you're making sure that you're filling up your bucket of rest and restore so that you're not out of whack here. And a lot of people are, which makes them not able to heal as well. It takes longer to heal, or they're not even able to heal at all because these autonomic processes are happening behind the scenes, getting in the way of healing happening. Emotional states are really important because taxing emotions can push us into fight or flight mode. And so emotional regulation is really important for optimal healing. And if there's challenges there, then it can get in the way of the healing process being able to be complete. And these are things that we can help you work with as well. We have a multi-dimensional aspect to our treatment approach here. All right, so skipping back towards the end, we're coming in for a landing. And, it can be really hard to figure out what is going to work best for you as far as solving your neck or back pain or preventing it happening in the first place. And it's really important to understand that it's not just one thing that's going to solve the problem. When it comes to neck and back pain, it's so complex. It's going to be multiple things needed to solve the issue. And we can help you to identify the root of the issue if you come in for an evaluation. We also do free doctor phone consultations. So if you're not quite sure yet whether we can help you or if this is right for you, then we're happy to get you going on a phone consultation. Another great way to at least start moving the needle is get involved in our small group classes. We have a lot of people that start feeling better or even get completely well just from being participants in our classes. A great class to start with is our MELT method class, or it's also called Ease Pain and Stiffness. So we have a treatment journey that most people go on. Phase 1, releasing stuck joints, releasing muscle tension and spasms, releasing fascia restrictions to more normal movement, retraining proper muscle activation patterns. Phase 2 would be beginning to build that strength and continuing to keep the tissues mobile while we do it, because as we build strength, sometimes there's a little bit of a yo-yo that happens. We're building the strength, some muscles tighten up as we do that, and we have to do some techniques and interventions to calm them down as we're strengthening, or to keep them nice and stretched out or in the optimal length while we're strengthening you. And then phase 3 would be building specific strength for your goal activities, and phase 4 is maintenance, where people are often doing things. We want you to be independent. You have your tools, you've learned what to do, and you're doing it. So my maintenance program is really doable, and I think it's doable for most of you. I mean, right now I'm super busy working in the business, working on the business, and just working a ton. So I don't have a lot of time, but I do make the time to keep my health, because if I don't have my health, I don't have anything. I know that because I've been down that road. So I do 5 minutes of melt every day. And it's as easy as actually, I do some self myofascial release with a softball to the bottom of my foot, which is going to help my back, my knees, my hips, and my feet. I do that while I brush my teeth in the morning. And I do some melt to my hands while I'm sitting at traffic lights on my way to work. I just have the balls sitting in the console of my car. So I figured out a way, right? So I do 5 minutes of melt every day. I do 45 minutes of melt on the weekend. So I use the melt roller and the balls, and I do a full body, just release stuck tension and stress. And I do 30 minutes of strength exercise twice a week. And I get in some cardiovascular, like 30 minutes, 5 times a week at least. Even if it's just a walk in the evening with my husband and my cat. We go for walks. My cat is an unusual cat. She follows us around like a dog without a leash. It's pretty fun. And I do some vibration. So I'll do at least twice a week using a vibrating ball. I do a sequence of different vibration things to just keep myself nice and loose. So that's a very doable routine, even for someone, I mean, I'm sometimes working 60 hours a week. And I think most people can find the time and figure out a way to do it. So we have 4 pillars to good health: proper exercise, making sure that you're doing the right exercises the correct way, proper nutrition, proper sleep, and proper recovery. And these are the 4 legs of our table of good health. And if you've only got 2 of those legs, oh man, it's not really a table anymore. Right? If you have 3, it's a wobbly table. All right? We need those 4 pillars. And where I find most people really need some more knowledge, because there is just so much more knowledge about what to do now that a lot of people aren't aware, is proper recovery methods. So MELT method is a good one. And if you don't know anything about it, coming to our MELT method class is a great way to start to get an introduction, because then you can test it out on the actual tools. And if you're watching us remotely and you're not too sure about it yet and you have a foam roller, then join a MELT class at least and try it with the hard foam roller. I've had people get actually well with their issue just attending our MELT classes using their hard roller. So that could be you. Vibration, stretching, these are really important things for proper recovery. And myofascial release, of course, as well, which the MELT method is a form of myofascial release, but you just do it to yourself. All right? Making sure you're getting proper sleep, crucial for so many different reasons, and we could do a whole talk on that. So just in conclusion, all the things that we talked about are, it can still be hard to figure out what is the next step for me. What's the best step for me to take at this point? If you have pain right now, you might be concerned about making it worse. Or maybe you're feeling unsure because you've tried other things before and they didn't work. Well, a couple things about us. If you start on the physical therapy journey with us and you don't feel that you got high quality care and you don't feel that you got good value for your money, then you can ask for your money back, and we have a satisfaction guarantee. I'm that confident that what you're going to receive here is going to impress you and is going to move the needle in the right direction for you. If you're really just wanting to test the waters and dip your toe in the water, some of the things we've talked about seem to make sense to you, but you're still kind of unsure, then getting started with our group classes is a great way to make a huge difference for yourself right away. So I highly recommend you get involved with that. We have a $1 taster that you can do if you've never done anything with us before. Just hop onto the website and sign up for that $1 taster. And you'll get unlimited classes for 4 weeks, and you can see what a difference it makes doing things using our paradigm and our protocols. I'm going to come back so you can see me here and away from the screen share. So If you're just really unsure about what's the right next step, maybe you have a lot of pain, you're not sure about going into a group class, then just sign up for a free doctor phone call. We'd be happy to chat with you and help you identify what a good step would be for you to take next, just based on your story. You could also just reach out and ask for a free report. I've written free reports on many topics of common issues that people have with pain, and we'd love to share that information with you. So again, thank you so much for taking the time to listen. I really appreciate it. I know how precious your time is. I know how precious my time is. And I'm just happy that someone else is valuing their health as I do. I think health is everything. And we're just happy to be partnering with you to help you make a good decision for your health. So reach out if you have any questions at all. And thanks for your time.